Now, with a report for women, here's Laura Windsor.
It's easy for a woman to guess wrong about a vaginal infection without knowing the correct symptoms to look for. So we asked Dr. Ava-Mahapatra of Desert Regional Medical Center in Palm Springs what symptoms women need to look for before buying any over-the-counter medications.
Yeast infection is a very common vaginal infection among the sexually active or childbearing women. It's not the number one cause of vaginitis. Number one cause of vaginitis is what is called bacterial vaginosis. The yeast infection is the second most common cause of vaginal infection. And there are a lot of confusion about the yeast infection. They are not properly treated by buying this medication over the counter and treating themselves. So it is very, very important for the woman when she develops the symptoms, she should consult her doctor. She needs minimum one office visit for a physical examination, some tests to make sure whether she has yeast infection or other kind of infection, like I said, the bacterial vaginosis, which is the most common infection. Usually, the yeast infection, you will have some vaginal itching, white or cottage cheese like vaginal discharge, some discomfort in the perineal area. The medications are the best treatment for yeast infection. There are alternative medicine, herbal medicine, they are available, and some of the naturopaths, they are recommending them. Maybe diet and lifestyle changes could help a little bit, but some of them like antigens against candida and some of the herbal medication, they may have serious side effects. It could be harmful to your health. Some of the diseases could make you to develop yeast infections more often, like diabetes, or if you have HIV positive women or immunocompromised women. And many times taking antibiotics and other drugs, it changes the vaginal flora and makes the overgrowth of yeast. Usually you see it during the sexually active periods. Maybe with intercourse it changes the vaginal flora, but it is not a sexually transmitted disease, and your partner is not going to get infection just having intercourse with you. If you have the symptoms of vaginitis, just don't think it is an yeast infection, because it is not the most common vaginitis, number one. Number two, you could have other underlying diseases, or you could have a sexually transmitted disease. So it is very, very important, come see a healthcare provider and have appropriate examinations and tests to make sure you don't have the other diseases, so that we won't delay the other kind of conditions and create more problems.
If you suspect that you might have an infection, seek medical advice first before you reach for the over-the-counter medications. For the American Health Journal, I'm Laura Windsor.